So one of the places that can get really restricted with a lot of people is this line coming through here. So you have your sternum on the inside and then there's ribs just to the outside of this. And this junction actually has a lot of connection with chest muscles which can impact our shoulder movement. And if we become restricted and tender here, this can impact our ability to go backwards, get our own arms overhead, or it could maintain us in this flexion position. So what you can do is just gently, with your fingers, find points just to the side of the sternum and just push in. Not too hard, but what you'll notice is there may be a point which is particularly tender. You don't want it to be like a 7 or 8 out of 10, but once you notice the point of tenderness, which will be easy to find, what you're going to do is just make gentle circles like this in any direction, or just moving up and down like that. Now what you can do is, in tandem with this, is just roll the shoulder backwards and forwards into circles like so. So you start off with small circles like this, and if you can coordinate it, just really small movements through here. So you could do just a few circles in the part of the tissue which feels restricted, then a few circles of the chest. Then you could go a few more in the point that's sore, and then bigger circles like this. Then finally, once you've done a little bit more in the tissue and you're starting to feel that it's not as tender, then you can start to add some rotations. And again, just keeping the fingers on that point of tension there and just moving through like so. So big circles like this. It's very normal to find these tender points, but it's a very good thing to work on if you've been seated a lot and or before you're going to train in the gym and doing upper body. So again, it's just where the sternum is out to the side, follow it up in different points. There may be several, but I will just work on one at a time and then work through until you've seen a tissue change and a change in the quality of your shoulder movement.